This is Cynthia doing Reflexology on Elizabeth. So we're warming up the feet, warming up the lotion in our hands, lots of viscous pressure, and working on the top of the feet. Again, we have someone who is ticklish, so we're trying to use as much pressure as possible without it being deep and uncomfortable. Going up into the leg, working on the top of the foot, working 4 lines on the top of the foot, gently working the malleoluses, lateral and medial malleolus, and working the brain, the face, and the neck. That is what we think of in reflexology has to do with the reflex points on the body. Top of the face and the neck, right here on the top. There we go. And what we'll notice is that there's blisters in different areas. Sometimes they're wear blisters, and sometimes they have to do just the type of blister. They'll have to do with pain in the body that has to do with an organ system in the Chinese medical system. It doesn't mean that if I feel the liver in Chinese medicine that your liver in Western medicine is upset, because they actually have 2 totally different physiologies. But sometimes what I will find is I'll find soreness, especially across the arch, for a lot of the ballerinas that I treat, for a lot of the people that are in, I guess waitressing jobs don't really use high heels anymore, but people that are in high heels in a corporate job, the arch can be very, very sore. So the outside of the foot actually has to do with the spine, and we're pinching it and squeezing it very gently and working up 5 lines of the foot on the underside. It's hard to see with the camera, but there we go. So we're going to turn the ankle just a little bit, never working into a place where we could cause injury. We never want to injure a client. We're just getting a little bit of traction and joint manipulation, which sounds kind of aggressive. It doesn't need to be. We're pulling on the metatarsals, getting them arched into my hand and moving into the foot. Metatarsals are right here. We use them when we are running, anytime we're jumping, anytime we're doing a lot of stage combat. And we will switch to the other foot. 4 lines on the top of the foot. Medial and lateral malleolus, and moving into 5 lines on the base of the foot. We're arching into the arch of the foot. That actually feels more sore. Is it more sore on this side, Elizabeth?
Maybe, yeah.
Maybe? You're just relaxing. And pinching Gentle pinching on the outside where the spine is in the Chinese medical system of reflexology does not mean that the spine is damaged, can just mean that the spine has pressure on it, which reflects on the outside of the ankle, which actually makes a lot of sense biomechanically. Head, face, and neck. Head, face, and neck. Head, face, and neck. Turning, getting that joint play. And moving the ankles to the outside, then moving the ankles to the inside, then stretching the calf. Moving the ankles to the inside. Beautiful. And stretching the calf. And stretching the calf. And moving the foot into a point. And stretching the calf. And moving on one. Working on both of them at the same time. Top of the foot. Gently 4 lines. And top of the toes. Finger circles on the top of the toes into the nail bed. With some clients, we're looking for foot ulcers. Not with this client, but for some clients that have more systemic diseases in their bodies, making sure they don't have lots of blisters, open wounds, because that's something that the doctor needs to take care of. Medial malleolus and lateral malleolus. And stretching into tibialis anterior, which is this muscle right here. And stretching into tibialis anterior. Beautiful. And stretching into the calf, both sides. And stretching into the calf, both sides. And once more. And a flourish to end. This has been doing Reflexology with Elizabeth. This is Cynthia with Reflexology on Katie. So we're warming up my hands. We're going to get them nice and hot. There we go. And we're going to start with the big toe. Reflexology is working on points in the foot, the hand, and the ear, and getting those points to help with the organs and the meridian lines across the body. Sometimes I'll have a client that's actually in so much pain or in a neck collar, how we used to treat neck injuries with the collar thing, kind of like a dog collar. And we would have to do reflexology to get their body to relax before we could actually touch the neck to release it. That doesn't happen anymore because we don't use collars anymore, but we're working on the first toe, the second toe, all the way down to the heel. Third toe, fourth toe, and fifth toe. We're going to work with thumb circles going up, thumb circles going up, and being as gentle as we can. As the client has already stated, that the tops of their feet are very sensitive. So we're taking the side and pinching the side, which relates to the spine in Chinese medicine. The first motions that we did on the toes relate to the head, the neck, and the face. Is that okay for pressure?
Yeah.
Okay. Now in Thai massage, we do reflexology with a blunt stick, and it is super painful. It's very effective, but we don't do that here because it's too much for people. And anything that is too much is not helpful because your body will go into a stress reaction. We're going to switch and work gently up the foot. Again, working with my hands on the underside of the toes and the metatarsals and the tarsals. Metatarsals means midfoot, tarsals means toes. This is the head. Reimagine the head. This is the face. And down here is the neck. So we're working on the neck by going across. Again, head, face, neck. Head, face, neck. Head, face, neck. Going across. And baby toe, head, face, neck. pinching the outside of the foot, which is considered the spine in Chinese medicine. And using our thumbs to work the 5 lines upwards, while trying as much as possible not to put pressure on the top of the foot. There we go. Beautiful. This is the injured ankle?
Yeah, but it's mostly healed, so she's okay.
Okay. We're just going to do circles of the foot, not of the ankle. This is called joint mobilization. We're gently mobilizing the joint by pulling it to the outside and the inside. On the other one, we'll move more of the ankle. There we go. Working on the bone, the malleolus, medial and lateral malleolus, making sure that we're not moving the ankle too much because we have an injury or a recent injury that has been healed mostly, but working tibialis anterior into, peroneus, tibialis anterior, peroneus first, tibialis anterior next. Next, we're going to gently stretch the foot. And stretch the foot down. And stretch the foot out to the side. And stretch the foot to the inside. I'm moving up the 5 lines with my fingers. I'm going to use the cloth or to wipe off the lotion. Beautiful. Thank you very much for watching Reflexology. Hi, this is Cynthia. We're going to do Reflexology with Ashton. Working on the feet. Four lines of the foot. Gently working on the arch of the foot with my thumb. Working on the heel. Heel circles. Moving up into the arch. And moving up into the metatarsals. Stripping down the arch. Moving into the other side. Gently warming up the foot. Into the arch. Into the metatarsals. Four lines of the top of the foot. And again, the arch of the foot, arch to metatarsals, tarsals, working on the top of the toe, which is supposed to be the head in reflexology, the face, and the neck. Each different part of the foot reflects a different part of the human body. Especially when we go into the ears, there's an entire body in the ear that we use ear seeds for to help to do acupuncture with. Reflexology is sort of like really gentle acupuncture. Pulling on the toes gently and moving to the other side. Top of the toes is the head, the face, the neck. Top of the head, the face, the neck, the head, the face, the neck, head, face, the neck. Both sides. We're going to do some range of motion activities with the ankles. Are there any ankle injuries?
I do, yes.
Okay, we'll just be very, very gentle. Circles for the ankle and stretch and pull, and stretch and pull, and stretch and pull. 5 lines on the top of the foot. We will use my cloth to gently take off all of the lotion. It gets stuck to the floor. This has been Reflexology with Ashton. We're doing 5 lines from the feet down to the ankle, thumb circles all the way down, thumb circles all the way down, and thumb circles. Now we're going to pinch the foot and go all the way up to the toe and pull. Pinch the foot all the way up to the toe and pull gently. Pinch the foot all the way up to the toe. Pull. Working on the metatarsals. Thumbs into the base of the foot, the plantar aspect of the foot. I'm going to stretch and push back against me. And push back against me. And relax. And push back against me. And relax. Both toes at the same time. Into the center. Head, face, neck. Head, face, neck. Head, face, neck. We are working on an overworked foot, but we are doing it gently because if we do too much into this arch, it's going to be super sore because I can feel it right there. It's sore there, hey?
Yeah.
Yeah. Okay, breathe, please. And in reflexology, this is the hepatic flexure. So the idea is that the whole large intestine is traced on the foot like this. Different organs organs and meridians. It won't have a direct effect. Like, it's not saying that there's something wrong with it. It's just saying that that's where kind of the stress is from walking, is in an area that reflects into how your liver and spleen are working, because the opposite will be true probably right there. Again, not something wrong with liver or spleen, because liver and spleen actually mean something different in Chinese medicine than they do in Western medicine. We're doing lines. Right there into the arch, hey?
Mm-hmm.
Okay. Do you wear orthotics?
No.
Good, but you have good shoes? that have
Yeah.
a good arch in them?
Yeah.
Okay, awesome.
I found some that I love.
Good.
Yeah.
Now buy a few pairs and rotate them.
Yeah.
Yeah, I wear these shoes, and they're like, they would cost a lot of money, like $250, but I buy them I buy 2 pairs and rotate them on opposite days, and they lasted. These ones I've had for 3 years now.
Okay.
So. We're going to switch. 5 lines on the dorsal aspect of the foot. Head, face, neck. Head, face, there we go, neck. Head, face, neck. Head, face, neck. Pinching up. This area is supposed to represent the spine in Chinese medicine. So this would be the shoulder, but this is probably just because you're on your feet all the time that there's a callus. Yeah. And stretch. Push back. And relax. And push back. And relax. And push back. And relax. Push up against my hand. And relax. And up against my hand. And relax. Beautiful. And out to the side. And then we will do into the foot. Across the body. And back into the arch of the foot, which is probably just as sore right there. Yeah? Okay. Bilateral soreness is actually a good thing.
Good. One thing is balanced.
Yeah. Thumb stripping into the arch of the foot. Working. We're going to stretch a little bit. There we go. Is that too much or is it okay?
It feels good.
Okay, beautiful. little bit there. Not so much.
Yeah, not as
Beautiful.
not as intense. Yeah.
Awesome. Okay. Thumb stripping into the arch of the foot. Out on each side. Does that hurt your knee at all?
No.
Okay. Because when we know we have an injury, we always want to make sure that we're not hurting it. Both sides?
Sorry.
Is both sides sore there? Are both sides sore there at all? No.
But like, it actually feels okay after working on them for a bit.
Okay, awesome.
Yeah.
Good.
Like, it doesn't feel like much.
That's awesome. Good.
I would expect more, actually.
It's working, the
Yeah.
reflexology.
And clearly, I'm very relaxed.
You're like, what?
I told you, I'm sleeping here.
Words. Sleeping. Beautiful. This has been Kelsey's Reflexology with Cynthia. Hi, it's Cynthia. We're going to do reflexology today on Sam. And if you like the video, please subscribe below. So we are applying the lotion to the top of the foot at first. Reflexology is the idea in Chinese medicine that there are meridians and organ energy all throughout the body, specifically in the feet, the hands, and the ears. So we have making 5 lines: big toe, pointer toe, third toe, fourth toe, the malleoluses, those are the bones on the side of your ankle, circles around them. They have to do with the testes and the prostate on the male. On the ankle, we're working on the Achilles, pulling the Achilles down, stretching Achilles, and back and forth gently on the Achilles tendon. Beautiful. Again, 5 lines. 4th toe, 5th toe, and working on the side, pinching the side up to the baby toe. Top of the toes are the head, the eyes, the face, the neck, We're going to do both the bottom of the foot, the plantar aspect of the foot, and the dorsal aspect of the foot, which means this part here. Let's watch the top of the foot going across the top of the back of the neck, top of the face, head, back of the neck. Ooh, there's some lint. Back of the head, back of the head, and the neck. And here we have the pleural cavity. Pleural cavity means where the lungs, the heart are in the energy system for the meridians in the Chinese medical system. We don't want to go super deep as we start. We're doing thumb circles all across. And then here, going into the intestinal area of the meridian system, Chinese medical system. So when I say that, I don't mean that this directly tells you that the intestines might be sore. It just means the energy from the intestines. And intestines mean something different in Chinese medicine. We're going through the ascending colon up here to the transverse colon here. The hepatic flexure is right there. Again, it's the idea of the hepatic flexure. And transverse colon. And going down the side is the back, the spine. So we're going down the side with the hands, just like we're pinching the spine. Here again, reproductive organs on the heel. Thumb meeting across the heel into the stomach, the pancreas, the liver, the small intestines, the large intestines, all the way up into the pleural cavity. And beautiful. Just doing side to side motions of the thumb, stripping side to side, kind of waking up all these energy points in the foot. So I don't know if you've ever seen those magnetic foot mats that have prickles on them, but those have to do with the energy of the meridians in the foot. And that's what we're doing today. So let's move to the other foot and repeat what we've done. We're going to find that there are different organs on this side because we are actually mirroring the body. So on the left side is mostly the liver. On the right side is the spleen and the pancreas. Stomach, jejunum, duodenum, duodenum, depends on how you say it, and thumbs gently in 5 lines down the foot into the malleoluses, circles around the malleoluses. And gently using the whole hand to stretch up that large and small intestine on the plantar aspect. We're going to go into the head, the face, and the neck. The head, the face, the neck. Head, face, the neck of the third toe, fourth toe, same. Fifth toe, same. And working here into the heart, working here into a little bit of the liver. The liver comes over to the right side a little bit. And then we have the stomach. The stomach is going to pylorus. The stomach makes a J, just as it does in the body, up and over into the pylorus sphincter. Spleen, right here, and pancreas. Now, it doesn't mean that if someone's diabetic and we massage their pancreas that they can get better. But there are some pretty amazing medications that we cannot talk about, but can be recommended by a doctor to help just with prediabetes, and then obviously the treatment if you're actually in diabetes of insulin. The reason why I say that is sometimes people say that reflexology can perform miracles. I am not above believing in miracles, but I'm certainly not ready to create them. I don't think I'm that talented yet. We're working on the transverse colon, going to the splenic flexure right here, going down to the descending colon. You can see that the client is, are you ticklish or is it painful?
No, I just had it.
Okay, cool.
Cheek scratch.
Okay, cool. Awesome. Descending colon and out to the rectum and the anus. Obviously, we're not actually going to those areas. We're just working on the energy bodies that reflect the descending colon into the rectum and down. Working on the inside arch is just very relaxing for clients because this arch often isn't supported in some shoes, especially dress shoes. And I'm not so familiar with what Sam wears to work, but it's always a nice thing to relax this interior arch. And we have the heel of the hand, or the heel of the foot, I suppose. Massaging here and back into the Achilles tendon, stretching out. Achilles going back and forth and stretching and stretching. We're going to do lines on the bottom of the foot. And lifting up, all the way up to the top of the toes and therefore the top of the head. On the outside of the foot, doing those squishes between the thumb and the first finger, squeezing that outside spine. I'm going to stand up, not because you guys have to stand up, but just to stretch the ankles. 2, and we'll go to 3. And then gently moving the ankles from side to side, stretching out the knees and the hips very gently. Don't want to push. Lots of people will push at the same time, which means that you can damage the adductor, you can damage the interior of the knee. We don't want to do that. Like if we press super hard this side to the table, we just want to go gently. Moving up the feet into the head, moving the energy. Beautiful. Next, we have a down position where we're stretching tibialis anterior and peroneus. We're stretching the toes. And next, we have the big toes touching. Not quite actually touching, but we're just stretching these ankles. I'm going to sit down again, grab the hand, grab with my hand the foot, and do rotations. And rotations. And we'll go back into the other direction. We're going to rotate the ankle into the interior arch, and we're going to rotate the ankle towards the exterior arch, or where the spine is in the meridian system on the foot. Just working out the head of the toes, and again, ascending colon to transverse colon, working on the liver, over to the transverse colon, the splenic flexure, and the descending colon. Transverse colon, splenic flexure, and descending colon. Out here, heart. Stripping down the foot into the area that is the spine in the reflex areas of the acupuncture body of the foot. I'm working on both feet at the same time. We want to relax the body as much as possible. Relaxation helps the body to heal. When people are in their parasympathetic system, they are in a rest and digest. When they're in their sympathetic nervous system, they are in fight, flight, freeze, or fawn. We don't want people to be in fight, flight, freeze, or fawn. We want them to stay in rest and relaxation. I'm going to start by wiping off the lotion. We have a clean towel. Place it over the foot. We start from the bottom and work our way up, so that the client doesn't walk away with sticky feet in their socks. That is uncomfortable. Turning over the towel to the other side of the foot in case the client has any kind of bacteria or fungal growths like athlete's foot, like itchiness. We want to make sure that we're using clean towels on each foot. So we'll just use different sides. This has been Cynthia doing Reflexology for Sam. Thank you for subscribing, guys. Hi, it's Cynthia. We're going to be doing Reflexology on Emily. So reflexology is working on acupressure points across the foot that relate to organs and meridian lines in the whole body. There is an entire body in Emily's foot that relates to the organs and to the meridian lines. We want to make sure that we're using tough pressure, but not such pressure that she's ticklish or sore from the reflexology. So we're doing 5 lines on the top of the foot at the same time. Right there. Beautiful feet. The top of the foot right here is the head. The face is right here. The neck is on the underside, right there. And we go down into all four toes after the big toe. Stretching the toes. You're going to gently bend your foot and massage underneath it to relax the foot. Beautiful. Is that sore? No? Okay. Thumb circles across the bottom of the foot. Going to the outside is the spine. Do thumb pinching with my hand all the way along, and this part represents the spine in the back. I'll strip down the foot, strip down the foot, and strip down the foot. Beautiful. We're going to work on stretching out the top of the foot and the bottom of the foot. I'm going to grab the ankle and stretch and stretch and stretch. Then I'm going to pull back and stretch and stretch and stretch. And again, 4 lines on the top of the foot. We're going to move to the other foot. Still quite a lot of motion from the other side. 4 lines on the top of the foot. Working on the metatarsals, the foot bones. Stripping up with my thumbs, thumb strip and thumb pinch onto the sides of the spine reflex points in the foot. Working on the bottom of the foot with my thumbs. Working into all of the areas that feel tight to me. Are you feeling any pain, Emily? Okay, beautiful. I'm leaned forward into my wrists and into my elbows so that there isn't a lot of pressure. There is some pressure in my upper back, but that's okay because it also gives me a stretch. The joke in Thai reflexology is that you can never have enough pain. I don't believe in that. I think there's too much if we do it super deeply. There's also the joke of Southern Thai massage that there can never be enough weight, or someone can sit on you and it isn't enough weight or pain, and that's definitely not true. It hurts. We never want to hurt the client. We're here to relax and get all of these areas of the reflex points working into the foot. We're going to stretch the foot. We're also stretching the calf. We're stretching Achilles. Pull down the foot. We're stretching tibialis anterior and peroneus. And we move into working on both feet together. The idea of working on both feet together is to bring harmony into the sides of the body, because we do sometimes walk on our feet differently. We have postural abnormalities through our hips, through our shoulders, that affect how we walk. And sometimes that can come down into our feet. Not necessarily true in this case, but this helps to get the body to kind of sync up on both hemispheres of the brain. When you're working on the left foot, you're working more on the right hemisphere of the brain. And some of this is a little bit old science, so if I have any neuroscientists out there that can correct me, I am more than willing to be corrected, because I don't want to be teaching things that are old science or wrong. Science improves as we progress. I want you to push into my hands. Yep. And relax. And push into my hands. And relax. And push into my hands. Beautiful. Moving the feet and the legs out to get relaxation, to get movement into the knees actually, and into the ankles, because often when we rotate an ankle, it's pulling to the outside when we sprain it. So this is actually strengthening it, because I'm working on that external rotation. I want you to push against my hands. Yes. And relax. And push against my hands. And relax. And push against my hands. And relax. Beautiful. Perfect. Push back against my hands. Yep. Perfect. And relax. And push up. And relax. And push up. And relax. Beautiful. And this time we're going to bring the feet towards each other. You're going to push out against my hands. Perfect. And that actually strengthens this muscle right here. And relax. And push out. And relax. And push out. Beautiful. Perfect. We're going to work on the small intestine. Small intestine is right underneath. And then we have the transverse intestine. We're going up the ascending, across the transverse, up the ascending, across the transverse, across the transverse, down the descending colon, and into the points that represent the rectum. We're doing that because often people have trouble with their tummies or with their bowels, and it's just an easy way to get the muscles and the reflexes inside of those bowels to relax. It's also really good because that transverse colon represents the arch of the foot. So when we have high or low arches, or we wear lots of heavy boots right now during the winter, those arches are affected. I'm going to do circles. On the malleolus. Circles on the lateral malleolus. And we will do a little bit of work on the Achilles tendon. We're just stripping it with a pinch. We don't want to be too deep on it because it's very painful. Beautiful. We will now wipe off all the lotion from the foot because otherwise her feet are going to be all slimy. This has been Emily. This is Cynthia doing Reflexology. Please subscribe below.